Hi, and welcome to the Wayne Lemos podcast. I'm your host, Wayne Lemos, and we are on the third and brand new mini series, Get a Handle on Depression. This is episode 1, Understanding the Mechanisms of Depression for the Common Man. The definition for depression, or major depressive disorder as it's also known, according to the American Psychiatric Association, is that the disorder affects how you feel, the way you act. Fortunately, it's also treatable. It causes feelings of sadness and or loss of interest in activities you once enjoyed. It can lead to a variety of emotional and physical problems and can decrease your ability to function and work at home. That's the APA definition, that's American Psychiatric Association. There's another APA, which is the American Psychological Association also, just for the record. So in general, if we were to look at the symptoms of depression, we are looking at a loss of pleasure in activities from hobbies to spending time with family to even sex, feeling anxious and agitated, lack of sleep as well as oversleeping, slow thinking, speaking and body movements, problems remembering, fixating on the past, feeling sad and empty. Depression can also manifest as symptoms of migraines, headaches and backaches, etc. Here we also know that the DSM-5, that's the Diagnostic Statistical Manual of Mental Disorders, has included manic symptoms as part of the diagnosis of depression for patients not meeting the full criteria for a manic episode. A manic episode is a mood disorder where a person will experience abnormally high energy for a period of time, including euphoria, heightened creativity, excited fast speech, and other such symptoms, including also irritability. This could last for varying periods of time, from 5 to 6 days to weeks to months. Coming back to depression, neuroimaging has shown structural changes in gray and white matter in multiple areas of the brain. Gray matter is needed for functions in emotions, memory, and control of movement, among others, and white matter acts as a relay coordinating between different brain regions and modulates the distribution of action potentials. The areas of the brain that show structural changes under neuroimaging were the frontal lobe, the temporal lobe, thalamus, striatum, hippocampus, and amygdala. Frontal lobe is involved in decision making, problem solving, emotional regulation, intelligence, and expressive language. Expressive language is the ability to communicate thoughts and feelings through words and gestures. The temporal lobe processes auditory information and is also involved in the process of encoding memory. The thalamus translates neural impulses from various receptors to the cerebral cortex, which is involved in determining intelligence, personality, processing sensory information, as well as language processing, motor functions, planning and organization. Striatum is involved in motivation, decision making, and motor and action planning. The hippocampus, which is involved in storing memories and plays an important role in spatial processing and navigation. Here we go again to see the hippocampus remembering London cab drivers once more. London cab drivers are supposed to pass one of the most hardest tests to pass in the world. It takes them 2 to 4 years to study, during which time they have to learn and memorize thousands of streets and landmarks, etc. Here it was found that the size of the hippocampus in London cab drivers was actually larger than the size of the hippocampus in a regular person. And the last region of mention over here is the amygdala, which is involved in detection of threats and activation of the required fear-related behaviors. Here in this podcast, we're only going to have time for 2 different manners in which depression affects 2 different brain areas. Mind you, by pointing this out, we're not pointing out the whole and sole problem. It's multiple areas of the brain and multiple regions. But this will allow us to get an understanding of what actually happens to the brain and the brain regions during depression. Here we first look at the frontal lobe, specifically at the prefrontal cortex. Here research has shown that clinical depression can be associated with low gray matter in the prefrontal cortex as well as low concentrations of creatine. Here it was suggested that administration of creatine may improve mood. However, please do note, creatine also increases DHT, that's dihydrotestosterone, and is linked to male pattern baldness and aggression. In order to combat this, you may be able to use DHT blockers like pumpkin seeds and spinach. However, creatine has also been linked to vascular cardiac complications. This may be adjusted also with a higher fiber diet. However, I would strongly recommend visiting your doctor or a qualified nutritional specialist first for recommendations with the involvement of creatine in your diet. Getting back, dopamine modulates the prefrontal cortex, and the prefrontal cortex plays a role in attention, impulse inhibition, and cognitive flexibility, which is the ability to adapt your behavior and thinking to your environment. Depression has been known for dopamine dysregulation. Now that we understood how depression affects the prefrontal cortex, let us look at how it affects the hippocampus. Depression can cause memory loss, amongst other symptoms. Due to glucocorticoids, the neurons in the hippocampus shrink, which induces cell cycle arrest of the peripheral cells. The peripheral cells provide support and protect neurons. The glucocorticoids, furthermore, glucocorticoids eliminate activity-driven BDNF, brain-derived neurotrophic factor. BDNF in the hippocampus stimulates and controls growth of new neurons. Also of important mention, cortisol in depression can, as somebody else mentioned, lift the brakes of the HPA axis, meaning depression, if not looked into, can lead to dementia. The HPA axis stands for the hypothalamic, pituitary, and adrenaline axis. The hypothalamus controls your hormone system, the pituitary gland regulates bodily functions using the hormones it produces, and the adrenaline glands are involved in your response to stress, your immune system, and blood pressure, etc. Here, the HPA axis is put into a continual activation. The HPA axis mediates the body's stress response. So what causes depression? According to Harvard Health, that states that there are many possible causes, include faulty mood regulation, stressful life incidents, and genetic vulnerabilities. Here, in stressful life events, it could be found that people that suffer from anxiety and anxiety disorders like phobias and panic disorders, etc., have high association rates with subsequent depression. And with genetic vulnerabilities, researchers in London have isolated chromosome 3p2526. Here, scientists speculate that up to 40% of people who suffer from depression could be linked to this particular chromosome. And that's it for this episode of the Wayne Lemos podcast, recorded for community and recorded for you. On the next episode, we will be talking about the different types of depression. Till then, I'm your host, Wayne Lemos, saying goodbye and thank you for tuning in.